Hello, I'm Admiral Rachel Levine, the Assistant Secretary for Health at the United States Department of Health and Human Services. It is a privilege to be with you here today as we celebrate Sickle Cell Disease Awareness Month. And I'm thrilled to be joined today by Joel Brevel, the renowned medical mythbusters and social media influencer. Joel, thank you so much for being here.
Thank you so much for having me.
Oh, I'm so excited to discuss this issue with you about sickle cell disease and debunk some common myths. So let's proceed. Could you start by giving us an overview of sickle cell disease and why it's such a significant public health issue?
Absolutely. So, sickle cell disease is a group of inherited red blood cell disorders that affect hemoglobin, which is a protein in red blood cells that's responsible for carrying oxygen. What happens in sickle cell disease is the hemoglobin becomes abnormal, becomes sickle shaped. So, it becomes rigid, sticky, and shaped like a crescent. And those misshapen cells can actually block blood flow, leading to
Mm.
painful crises called vaso-occlusive crises. And over time, that can damage organs, lead to organ complications such as strokes, acute chest syndrome, or organ failure. And it's a significant public health crisis because it, in fact, impacts so many people. I think one myth is that people often think it just impacts people that are Black, but unfortunately, it doesn't. It impacts so many different ethnic groups. So people of African descent, as well as people from other ethnic groups, including people that are Hispanic, South Asian, and also those from the Middle East. In the United States alone, approximately 100,000 people live with sickle cell disease, and millions are impacted globally. It can result in high healthcare costs, frequent hospitalizations, lifelong management, and it has a huge impact on patient quality of life as well.
So let's talk about public education and awareness. Those are very important in combating sickle cell disease. So tell us about that and what strategies can be used to educate, of course, healthcare providers, but also the general public about sickle cell disease.
Absolutely. Public education and awareness is vital in combating sickle cell disease because early diagnosis and timely treatment can actually improve outcomes overall. So, education helps dispel myths and misconceptions like the one I talked about previously. It encourages patients and families to seek care early, and it can promote just a widespread understanding of how sickle cell disease impacts individuals, humanizing people. For healthcare providers and the general public, patients with sickle cell disease all benefit from targeted education efforts. So that can be through social media, that can help by reducing stigma and improving overall standard of care as well. And education for healthcare providers can look a lot of different ways. It could be training on the specific challenges of managing sickle cell disease. It can be recognizing and treating acute complications like pain crises, understanding long-term therapies like hydroxyurea or bone marrow transplants, and new things that are happening just every single day right now. And I think for patients, understanding that they're not alone is huge. There's advocacy that's done by sickle cell disease organizations. Social media is one that I use, of course, in terms of raising awareness. And then genetic counseling and screening programs are out there too to help at-risk families better understand their carrier status and making informed reproductive choices. So patients and families are often educated on disease management and techniques in the doctor's office. But I think there's so many ways that we can do it outside the doctor's office so people better understand diseases like sickle cell disease, early symptoms, complications, the importance of follow-up, and how to recognize it in their family and loved ones.
There are many challenges, of course, that patients with sickle cell disease face and their families. But one of them is actually accessing quality medical care, both chronic care, but also acute care when they have the acute crises. Tell us about that.
Absolutely. So patients with sickle cell disease face numerous challenges when accessing quality care. So as you mentioned, acute versus chronic, there's lack of access for specialized care. Not all healthcare systems are equipped with specialists in sickle cell disease. That can lead to inadequate or delayed treatment, especially for individuals who may have never seen what a sickle cell crisis looks like. It can be misdiagnosed, or patients often have told me specifically that they've been seen as drug seeking. And so those disparities in care aren't just about sickle cell disease, but it relates to race and socioeconomic disparities as well in terms of what's affecting access to care. Many patients are facing biases, inadequate pain management, and less access to advanced treatments as well, especially with those that have high price tags. And then there's the lifelong nature of sickle cell disease treatment as well. That means that patients often have to struggle with the cost of care, which may
Mhm.
not be fully covered by insurance. And it's a chronic disease. It's not something that goes away, unfortunately. And living with a chronic disease can impact a patient's mental health, their education, their employment, and that further complicates their ability to maintain their own health and care.
Well, so many challenges, but so many opportunities, for example, with new treatments and care paradigms. So in closing, thank you so much, Joel, for joining me today to help dispel myths about sickle cell disease. Together, working together, we continue to make strides towards a healthier, more inclusive future for everyone. So let's keep working together hand in hand to ensure that everyone living with sickle cell disease and their families receive the care, support, and understanding that they need and that they deserve. Thanks.
Thank you for having me.
Produced by the U.S. Department of Health and Human Services.